This is the gluteal region. This is the gluteus maximus muscle. Notice its thickness and its coarse fibers. It is the most superficial muscle of the region, and its fibers run obliquely downwards and laterally from its origin towards its insertion. It arises from the posterior part of the gluteal surface of the hip bone, from the back of the sacrum, and from the back of the sacrotuberous ligament. It has an oblique upper border which is separated from the iliac crest by a gap filled with the gluteus medius. This is the gluteus medius, with the gluteus minimus deeper to it. This is the insertion of the gluteus maximus into the posterior border of the iliotibial tract. It constitutes the superficial 3/4 of the insertion. This is the iliotibial tract. The muscle has also a deeper insertion into the gluteal tuberosity, which constitutes the deep fourth of the muscle. Notice that the insertion of the adductor magnus into the gluteal tuberosity lies in contact with the insertion of the gluteus maximus. The gluteus maximus is the main extensor of the hip joint. This is the gluteus maximus reflected laterally. Away from its origin, the structures deep to it consist of muscles, ligaments, vessels, nerves, and bony points. Starting by the muscles. This is the piriformis, which is the key to the gluteal region. Notice its round, slender tendon going to the top of the greater trochanter. It arises from the front of the middle 3 pieces of the sacrum and emerges from the greater sciatic notch. It is related above to the superior gluteal nerve and vessels, and is related below to the sciatic nerve, inferior gluteal nerve and vessels, posterior cutaneous nerve of the thigh, pudendal nerve, internal pudendal artery, and nerve to obturator internus. This is the sciatic nerve. It is the sickest nerve in the body. It arises from the sacral plexus and descends in the gluteal region deep to the gluteus maximus, and enters the back of the thigh midway between the greater trochanter and the ischial tuberosity. Notice the origin of the hamstrings muscles from the ischial tuberosity. This is the posterior cutaneous nerve of the thigh. Notice that it runs on the surface of the sciatic nerve and leaves the gluteal region to enter the midline of the back of the thigh. It has been cut at the point where it enters the thigh superficial to the long head of the biceps femoris. The sciatic nerve is, however, deeper to the muscle, so the long head intervenes between the two nerves. These are the inferior gluteal nerve and vessels. They were cut during the reflection of the gluteus maximus. They enter the deep surface of the muscle to supply it. The nerve comes from the sacral plexus, and the artery is a branch of the internal iliac artery. These are the three structures which pass from the greater sciatic foramen to the lesser sciatic foramen. They are the internal pudendal artery, pudendal nerve, and the nerve to obturator internus. The sacrotuberous ligament is reflected to expose these structures. This is the internal pudendal artery, which is the middle structure between the two nerves. It arises from the internal iliac and crosses over the apex of the ischial spine. This is the pudendal nerve. It arises from the second, third, and the fourth sacral roots. It runs medial to the artery and crosses over the sacrospinous ligament. This is the sacrospinous ligament. The internal pudendal artery and the pudendal nerve continue their course in the perineum. This is the nerve to obturator internus muscle, which is lateral in position. It crosses over the base of the ischial spine to enter the obturator internus muscle. Here is the lesser sciatic foramen. It leads to a canal known as the pudendal canal. This is the sacrotuberous ligament. It runs both the lesser sciatic foramen and the greater sciatic foramen. This is the gluteus medius. It is just above and anterior to the piriformis and lies edge to edge with it. Notice the thick gluteal fascia covering its superficial surface. Note also that it extends above the gluteus maximus, where it is used as a common site for intramuscular injection. To see the gluteus minimus, you must reflect the gluteus medius. Notice the superior gluteal nerve and deep branch of the superior gluteal artery as they run forwards between the gluteus medius and the minimus. The superior gluteal nerve supplies the gluteus medius, gluteus minimus, and tensor fasciae lata. Note that the inferior gluteal nerve supplies the gluteus maximus only. Notice also the direction of fibers of the gluteus medius and the minimus, which run almost vertically from the gluteal surface of the hip bone above to their insertion into the greater trochanter below. They are the only abductors of the hip joint, but the gluteus maximus is the main extensor of the hip joint. Below the piriformis and edge to edge with it lie the two gemellae and the tendon of the obturator internus. The two gemellae are one superior and one inferior, and overlap the tendon of the obturator internus. This is the superior gemellus above. This is the inferior gemellus below. This is the tendon of obturator internus covered by the two gemellae. The tendon of obturator internus runs horizontally to be inserted into the medial surface of the greater trochanter. Remember that the obturator externus arises from the external surface of the obturator membrane and from the surrounding bone, while the obturator internus arises from the internal surface of the membrane and the surrounding bone. Just below the gemellae lies the quadratus femoris. Reflection of this muscle shows the tendon of obturator externus on its way to its insertion into the trochanteric fossa. This is the tendon of obturator externus muscle, together with the ascending branch of the medial circumflex artery along its side, which is a branch of the profunda femoris. The quadratus femoris is a quadrangular muscle extending from the back of the ischium as its origin to the quadrate tubercle on the intertrochanteric crest. Now we shall see the sacrotuberous and sacrospinous ligaments which lie deep to the gluteus maximus muscle. This is the sacrotuberous ligament, extending from the ischial tuberosity to the back of the sacrum. Deep to it lies the sacrospinous ligament, which extends from the tip of the ischial spine to the side of the last piece of sacrum and first piece of coccyx.